so today I'm going to give Mrs. Bray her medications. So I am logged into my EMR today, and I know that I'm going to give Mrs. Bray her medication, so I'm going to come down here from my patient portfolio and find her chart. And so I have Jean Bray right here. So I'm going to go into my patient's chart. The first thing that I need to do is verify that I have the correct patient. So I have the chart for Jean Bray. Her date of birth is 8/12/59, and she has an allergy to codeine, so I have the correct patient. I'm going to go into my provider's orders here so that I can see what medications are due for Jean today. Alright, so we have several medications ordered for Jean today. Alright, so let me go into my MAR. Okay, so it looks like I have some medications that are due. So, alright, so I am going to give Jean her Coumadin this morning, and it's also time for her to have her Humalog insulin because it's breakfast time. So I'm going to check these medications against my physician order. So doing my first check of my 5 rights, I have Jean Bray, date of birth 8/12/59. She has an allergy to codeine. This morning she has Coumadin 5 milligram tablet, PO, scheduled to be given daily. And I'm just going to check that with my physician's order. So here's my physician's order. I have Coumadin 5 milligram tablet daily to PO to be given now. And then I'm going to do my first check of my second med. So again, I have Jean Bray, date of birth 8/12/59. She has an allergy to codeine. And she has Humalog insulin, 4 units to be given subcutaneously, scheduled to be given with meals, and so that's due now as well. So I'm going to find that on my physician's orders, and here I am confirming Humalog insulin, 4 units, subcutaneously, scheduled now to be given with meals. So that looks correct. So now I'm going to start my second check of my medications, and I'm actually going to go in and find these medications for Jean. So I know I'm given a PO med, so I'm going to get out a pill cup here. I'm also giving an injection, so I'm going to get out a couple of alcohol swabs. Alright, so here I have my Coumadin. So I'm going to do my second check of my Coumadin here. So I have Jean Bray, date of birth 8/12/59. She has an allergy to codeine, and I'm going to compare my medication with what's on my MAR here. So I have Coumadin 5 milligrams. It's a tablet. It's to be given PO daily, and it's scheduled to be given now. The medication is not expired. So now I've completed my second check of this medication. And then I'm going to find my Humalog insulin. Actually, I guess my Humalog is not scheduled. I have NPH scheduled for Jean this morning. So, let me go back. I'm going to check my NPH insulin. So, I'm actually not going to give the Humalog. It's not due at this time, but my NPH insulin is due at this time. So, she has, again, I have Jean Bray, date of birth, 8/12/59, allergies to codeine. She has insulin, NPH insulin, 12 units, subcutaneously daily, scheduled now. I'm going to check that with my physician order just to make sure that that matches. And here I have 12 units of NPH insulin daily, sub-Q to be given now, so that matches. So let me do my second check of my NPH insulin here. All right, so doing my second check, I have Jean Bray, date of birth, 8/12/59. She has an allergy to codeine. So comparing my medication here, I have NPH insulin. I'm going to give 12 units subcutaneously, and it's scheduled to be given now, and this is not expired. So I'm going to go ahead now and draw up my insulin for Jean while I'm still in the med room. Do some hand hygiene here. With NPH insulin, I need to roll the insulin to make sure that all the particles disperse within the vial. I'm going to clean off my stopper. Okay, and we're giving 12 units this morning. I have an insulin syringe here. That is a 100 unit insulin syringe. But I'm going to draw air to the 12 unit mark. So I have 10 units here. So I have 12 units of air. So I'm going to go ahead and inject my air into my vial. And then I'm going to go ahead and draw up my 12 units of insulin for Jean this morning. Making sure that I don't have any air bubbles in my syringe. All right, so I have 12 units of NPH insulin that I'm going to be giving to Jean this morning. Because this needle is still sterile, I can recap this needle through a scoop method. And I'm going to take this vial of insulin and my syringe to the room with me. I'm also going to take my medication to the room with me, but I'm not going to open it until I'm at Jean's bedside. Dispose of my trash here. Okay, put that over here for now. Okay, the other thing that I need to check is my lab values that are associated with these medications. So I know that for my insulin, I need to check Jean's blood glucose this morning to make sure that she needs this medication. Her glucose is 110, which is hyperglycemic, outside the normal range, so it's appropriate for Jean to get this medication this morning. And then with her Coumadin, I know that that is a blood thinner, and so I need to look at her coagulation times. And so these are within normal limits, her prothrombin time and her INR, so it is appropriate for Jean to get these medications this morning as well. Okay, now that I have done my 2 checks of my 5 rights in the med room, I'm going to go ahead and close out of Jean's chart, and I'm going to go into the room to administer these medications. I'm going to minimize my screen here so that I don't violate any HIPAA laws when I go out into the hallway and move over to Jean's room. Good morning, Mrs. Bray.
Good morning.
I'm Amber. I'm going to be your nurse today. How are you doing this morning?
I'm doing okay.
You're doing okay? So I'm coming in this morning to give you some medications. Are you able to take medications this morning for me? I don't
see why not.
Okay, I have one oral medication, your Coumadin, for you to take this morning. And then I also have an injection. I have your Nph Insulin for you to have this morning, okay?
Okay.
Okay, I'm going to go ahead and wash my hands, and I'm gonna sit your bed up here, okay? How are you feeling this morning?
You know, I slept pretty good last night, so I think I'm ready to start the day.
Okay, well, good to hear. Let me just get your bed raised up here so you're at a good height so that I can get you your medications this morning. And I'm going to go ahead and sit your head up as well so that you can swallow the pill. Is that okay?
Yes, that's fine.
Okay. Mrs. Bray, let me just get your chart pulled up here so I can verify that I have the correct person and that we have the right medications for you this morning, okay? So I am going to scan your wristband here, and can you verify your name and date of birth for me?
Jean Bray, and I was born January 1st, 19XX.
Okay, it looks like that matches, so I have the right patient. I've scanned your wristband here, and it does look like your wristband is a match to your chart, so everything is congruent there. So I do have Jean Bray, date of birth 8/12/1959. It says that you have an allergy to codeine. Do you have any other allergies that you know of?
Not that I know of.
Okay, well, let's go ahead and get started with this. I'm going to put on some gloves since we're going to be giving you some medications here. Okay, so let me get back so that I can again verify that I have the correct medications for you this morning. So, all right, so I've already verified that you are the correct patient. The first medication that I'm going to give you this morning is your Coumadin. It is scheduled 5 milligrams and it's a tablet, so it's going to be a tablet that you swallow this morning. It's scheduled to be given now, and it is not expired, so that looks good. I'm going to go ahead and scan my medication here. Okay, now Mrs. Bray, have you had Coumadin before?
Yes, they started it on me 2 days ago, I think.
Okay, good. So, again, I just wanted to give you some reminders about this medication. So, Coumadin is a blood thinner. So, things that I want you to watch out for are any bleeding from your gums, nose, any bruising that you notice. If you notice any things, I want you to let me know as soon as possible, okay?
I will.
And then I'll make sure that you have a soft bristle toothbrush so that you can brush your teeth with that. Do you need to shave at all?
No, I don't.
Okay.
Well, I mean, I still do shave my legs.
You do? Okay. So when you go home, I want you to make sure that you're using an electric shaver and not a straight razor. We don't want to risk any bleeding by you getting cut, okay?
Okay, that makes sense.
And I also want you to think about your diet. So you want to avoid any green leafy vegetables while you're taking this medication. So spinach, broccoli, kale, those types of things. They can inhibit the way that this medication works, and so we want to avoid those things right now, okay?
Oh, I love spinach salad.
I know, it's hard to change your diet, but we want to make sure that this medication works for you the way it should.
Okay.
Okay. All right, so I'm going to go ahead and open this up for you here. All right, and I'll just hold this up to your mouth for you. Can you swallow for me? Here's a drink. Did you get that?
I did.
Okay. All right. So we've taken our Coumadin here. So I'm going to just document that you got your Coumadin this morning. We gave the 5 milligram dose that was ordered. Let me document this. All right, and then the other medication I have for you is your Nph Insulin. So, let me do my third check here. So again, I have Jean Bray. We already verified your name and date of birth are correct. We are giving our Nph insulin this morning, 12 units. It's going to be given subcutaneously and it's due now. So I have Nph insulin. It is not expired and I have 12 units here. Now, Mrs. Bray, you receive insulin at home?
I do. I take the NPH twice a day.
Okay. So again, with your NPH insulin, this is a longer acting insulin, but I still want you to let me know if you start to feel shaky or sweaty or dizzy, tired, anything that might indicate to me that your blood sugar is going low, okay?
Okay.
Okay. And so we do this by injection. Where do you usually do these injections at, Mrs. Bray?
In my belly and in my leg.
In your belly and in your leg. Do you remember where you received it the last time?
in my leg.
In your leg. Okay, so would it be okay if I do it in your belly today?
Yes.
Okay. All right, I'm just gonna pull your sheets down just a little bit here and pull your gown up just a little so I can visualize here where I need to put this. All right, would this left side be okay?
Yes, it would.
Okay. Let me go ahead and clean off my side here. All right. All right, Mrs. Bray, just a little poke here. All right. Very good. That's done. Let me throw this away. You know what I didn't do is I didn't scan my medication before I gave it. But I did do my third check of my medication, so I know that that was correct. All right, so I'm going to mark that we gave your 12 units of Nph insulin in your left lower quadrant of your abdomen. All right. Okay, and now I just want to make sure that those saved. So yes, I documented your Coumadin this morning and your insulin this morning as given. Okay, Mrs. Bray, those are the two medications I have for you this morning. Is there anything else that you needed this time?
I don't think so.
Okay, well I'm going to go ahead and put your bed back down here, okay? Would you like to have your head sitting up or would you like to lay back a little?
I would like to lay back just a little bit. I think I'm gonna watch some TV.
Oh, perfect. Okay, lay your head back a little bit here. I'm going to give you your call light. So in case you need me, you can call me. Your bed is locked. It's in the low position. I'm going to clean up my supplies here. I'll wash my hands. All right, Mrs. Bray, if you need anything from me, you just go ahead and put on your call light, okay? And I will be back in to check on you after a little while.
Okay, thank